Good day and great health. Welcome back to another edition of your Lifeline of Vitality. Today on the podcast, the vagus nerve and the upper cervical spine. In upper cervical chiropractic, the focus is on the neurophysiology and biomechanics of the craniocervical joint. The four main sections to consider are the foramen magnum of the occipital bone, the atlas vertebra or the first cervical bone, the axis vertebra or the second cervical bone, and the brainstem of the nerve system. The nerve system in general does four main things. It controls all the movements we make, senses everything we feel, regulates all our body organs, and relates us to the outside world. To simplify, the brain stores information and generates electrical signals. The brain uses nerve fibers in the form of spinal nerves, cranial nerves, and peripheral visceral nerves to send that information out to the body. There are also nerve fibers at every organ, gland, and tissue of the body that send information back up to the brain for interpretation. All the trillions of nerves that make up the nerve system communicate with each other in a complete, unbroken cycle. An important meetup point in the nerve cycle occurs at the upper cervical spine. This is where the majority of nerve signals from the brain and body intersect. The upper cervical spine protects and surrounds the inferior section of the brainstem and superior section of the spinal cord. Let's look at cranial nerve 10, the vagus nerve, and its connection to the upper cervical spine. The vagus nerve is the longest and most complex cranial nerve. The vagus nerve originates in the brainstem at the medulla oblongata. It exits the cranium via the jugular foramen, which is found laterally on each side of the foramen magnum. Upon exiting the skull, it travels in front of the transverse process of the atlas bone, down the neck within the carotid sheath, and descends into the thorax and abdomen. As the vagus nerve travels down through the body, it innervates the throat, heart, lungs, and most of the digestive tract down to the colon. The vagus nerve communicates directly with the peripheral nerve system, glossopharyngeal nerve, spinal accessory nerve, hypoglossal nerve, superior cervical ganglia, and with the C1 and C2 spinal nerves. When nerves get stressed, it affects their sensitivity, perception, and behavior. There are three types of stress we deal with in life. The stresses are physical, chemical, and emotional in nature. These stresses create nerve tension, which imbalances the muscles of the spine. The nerve system will adapt to the best of its ability to these stresses and help bring the spine back into balance. If the stresses are too great for the nerve system to adapt, compensations arise. A compensation that occurs in the upper cervical spine is a vertebral subluxation. A vertebral subluxation will cause the atlas and axis bones to get locked in a misaligned position. This lock will perpetuate nerve tension, which imbalances the spine. A vertebral subluxation obstructs communication along the nerve cycle. This interferes with normal sensation, perception, and behavior of the nerve system. Nerve system function is disrupted. A functional disruption of the vagus nerve will cause a wide array of problems involving the autonomic system, the heart, lungs, digestion, and balance. The goal of chiropractic is to correct nerve tension and spine imbalance. Chiropractors do this by adjusting the vertebral subluxation of the upper cervical spine. Correcting the subluxation better optimizes the function of the brainstem and associated nerves. The nerve system can sense, perceive, and behave at a greater potential when a subluxation is corrected.